MMT, shoulder external rotation, infraspinatus and teres minor. Assist the patient to the prone position with the head turned to the test side. The shoulder should be abducted to 90 degrees with humerus fully supported on the table. Allow the forearm to hang vertically over the edge of the table. Place a folded towel under the arm at the edge of the table to keep the elbow and shoulder level to each other. Stand at the side of the shoulder being tested. Passively externally rotate the patient's shoulder. Stabilize the arm by placing your hand at the elbow joint to prevent the humerus from moving. You are not assessing the infield. You are determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to externally rotate the shoulder. Stabilize the patient at the elbow joint to prevent the humerus from moving. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the motion of horizontal abduction to assist with external rotation and motion that is not in the plane of external rotation. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the elbow. With your other hand, use 2 fingers to apply resistance at the wrist. The resistance is applied in a direction toward internal rotation. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in shoulder external rotation and holds against 2-finger resistance. Grade 4, good. The patient completes full range of motion in shoulder external rotation but breaks against 2-finger resistance. Grade 3, fair. The patient completes full range of motion in shoulder external rotation but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Keep the patient positioned in prone. Allow the patient's arm to hang down loosely from the shoulder in neutral rotation with the palm facing the table. You must again assess the available motion by rolling the arm into external rotation. Place both hands above the elbow joint to assess external rotation. The gravity-eliminated therapist position is to kneel or sit on a low stool at the test side of the patient. Instruct the patient to externally rotate the shoulder by turning the palm outward. You need to observe for the common substitution of forearm supination. Watch for the olecranon to move and not the hand to turn outward. Grade 2, poor. The patient completes full range of motion of shoulder external rotation. For Grade 1, palpate the infraspinatus muscle over the body of the scapula in the interspinous fossa. Palpate the teres minor on the inferior margin of the axilla and along the axillary border of the scapula. Grade 1, trace. Palpable contractile activity of either or both muscles with no motion. Grade 0, no palpable contraction.